Hi, my name is Sarah. I'm Quality in Education with Fairview Home Infusion. Today we will be discussing how to place a peripheral catheter and a little bit about the maintenance of that catheter. I want to point out that this video is intended as a resource on your already applied knowledge of the peripheral catheter. If you have any questions about our policies and as another reference tool, please go to www.fairviewhomeinfusion.org. Hand hygiene is one of the most important things that we can do to prevent infection. There's two methods to hand hygiene. One is soap and water, and two is using alcohol-based sanitizer. If your hands are visibly soiled, you've recently had an interaction with a pet, if you've recently used the restroom, have a patient with C. diff, or if you have eaten recently, you would want to use soap and water. If you have not had any of those occurrences, you can use our alcohol-based hand sanitizer. For soap and water, you want to run the water warm, apply the soap, create friction, and rub all surfaces of your hand with the soap and water for a minimum of 15 seconds. For the alcohol-based rub, you want to apply it to your hand per manufacturer's guidance and rub all surfaces. Once all surfaces have hand sanitizer on them, you want to allow that hand sanitizer to dry naturally. You don't want to wave your hands or fan. So while it's not required to remove dangling lanyards, necklaces, scarves, or dangling bracelets and rings, it is recommended. The reasoning is dangling necklaces or lanyards and dangling bracelets may interfere with your PPE and contaminate them, such as sterile fields or sterile gloves. High-profile rings have the potential to harbor bacteria along with puncture through your PPE, such as sterile gloves. In this occurrence, you would have to remove the sterile gloves and discard and apply a new set of sterile gloves. If you do have these things, please remove them before you perform hand hygiene. The first thing you want to do is gather your supplies for your catheter. I do want to mention our policy currently states that we can leave a peripheral catheter in place as long as it is patent and free of complication. This means that we at least need to do a dressing change using our dressing change kit at minimum of every 7 days, or if the dressing becomes compromised. So the first thing we'll need is our IV start kit. The next thing we will need is our saline flush, our extension set, our mask, and a catheter of the correct size. We typically use two different sizes of catheters. One is a 24, one is a 22. We also need our non-sterile gloves, our hand foam, and our sharps container. So in this video, we will be discussing how to apply the tourniquet, some tips and tricks to finding a vein, and also some areas to avoid. And this is my patient, Teresa. So a couple tips. The first tip would be to dedicate one of your fingers. I prefer my middle finger to find a vein. This forms sensitivity to that finger, so when I use that finger constantly, I'm able to find veins a little bit easier. A couple other little tips is gravity is your friend when placing a peripheral catheter. If I'm having trouble finding a vein, I can easily have Teresa drop her arm for a couple of seconds and allow that blood to pool to the bottom of her hand. A couple other little things. Heat is also your friend. You may use a warm pack for about up to 5 minutes to help bring circulation to that area. A couple other little things that I've noted in my history of nursing and working out in the field is if I had a patient that I knew was a difficult stick, I would have them jump in a warm shower before I came so that the veins were easily palpable when I was ready to perform our peripheral stick. Another tip is if your patient has fragile veins or if you're having a hard time locating the vein, you can easily use a blood pressure cuff. To do this, you want to place it 4 to 6 inches above the anticipated access site, and you want to ensure that it is not on a joint. From there, you're going to pump it up until you reach a pressure that is comfortable with the patient and feel for vein distension. If you still do not feel vein distension, inflate the blood pressure cuff another 10 to 20. Continue to do this until you feel adequate vein distension. Before I palpate for a vein to identify a potential site for this peripheral, I want to do hand hygiene. We do send antimicrobial foam to the patient's home, and you want to just rub that until dry. So now that my hands are dry, I'm able to palpate around and find a potential source. A couple things to note. We don't want to place a peripheral catheter in the antecubital and leave it in place. That's an area of flexion and that would cause pain and potentially break off that catheter. A couple other places, your wrist is not a good place and you should never place a peripheral catheter in the wrist. And that goes for the side of the wrist as well, as that is an area of flexion and can easily dislodge that catheter when placed. If Teresa had an injury on this arm or previously had a stroke, you would not want to use it. The best place to place a peripheral catheter is in the forearm. The forearm is going to prevent some complications and is also going to be able to dwell longer in the forearms. Hand veins don't work the best in a home setting because the patient's going to continue doing their activities of daily living. So hand veins will not last that long. So forearm is best. So now that I've kind of decided where I'm going to palpate, I'm going to rewash my hands and grab our IV start kit, which has my gloves, my chlorhexidine swab, my dressing, and my tourniquet inside of it. When opening, you want to pull back, make sure that you're not touching the center or within the bucket. So now that it's open, I'm going to take out my sterile gloves and place those aside. At this point, I can take out my drape and place it underneath Teresa's arm. I'm going to retrieve my garbage bag and open that up. And now I can grab my tourniquet to use. When taking things out of the bucket, make sure that you are not touching the swab stick used for cleaning. When placing a tourniquet, you want it 4 to 6 inches above where your anticipated site is. It's very important that you always check your tourniquet after placing to ensure that it's not too loose, which will not allow the blood to pool and distend the veins, or if it's too tight, it will cut off the arterial circulation, once again preventing the blood from pooling appropriately. So now that the tourniquet is placed, I'm going to check Teresa's forearm for a vein that is bouncy or resilient. If you find a hard vein, you do not want to use that vein. That indicates that vein has scarring. So I'm just going to palpate around. If you're having trouble finding a vein, start up higher where you know where you can visualize a vein and work your way down. You want to do both. You want to visualize a vein and also palpate for that bounciness of a vein. So I'm just going to have you turn your arm. Position is key when placing or finding where to place your peripheral catheter as well. As if I turn Teresa's arm here, I can better palpate the vein that runs along. Whereas if it's flat, that vein disappears. So after I find the location, I'm going to discontinue the tourniquet. So now I'm going to gather my supplies that I need for the actual procedure. I will once again need my mask. I'm going to get my extension set ready and primed. I've selected my size and gauge of needle, and I have my kit. I will also need my sharps container to dispose of my sharps after the peripheral is placed. So first thing I'm going to do, I'm going to place my mask and wash my hands. Once again, when washing your hands, make sure that foam is evenly distributed all over your hands and is allowed to dry. I am now going to open up my extension set and throw away my garbage. Saline syringe to prime. As long as you have not touched the needleless connector, you can go ahead and place your syringe and prime that tubing. If you did accidentally touch the end of that needleless connector, go ahead and scrub it with an alcohol wipe for 15 to 20 seconds. Now I'm going to go ahead and open my catheter, making sure not to touch the catheter itself. Wash my hands before providing patient contact. I'm going to place my non-sterile gloves and retrieve my chlorhexidine swab. Make sure that when you are taking this out of the packet that you do not touch the foam area of the swabber. You can go ahead and crack it until you see solution at the bottom. So now, wherever you are going to touch with your sterile gloves, you are going to want to clean that with the chlorhexidine. The way that chlorhexidine works is a scrubbing motion for a minimum of 30 seconds. All right. Now that that area is cleaned, I'm going to toss my chlorhexidine and remove my gloves. I now can reapply my tourniquet. Checking to make sure that it's not too loose or too tight. From here, I want to rewash my hands with the alcohol foam. And apply my sterile gloves. Make sure that when doing this procedure that you remove all wrist jewelry, dangling necklaces, or rings to prevent contaminating your PPE. So now I'm going to open up my gloves and apply them. Now that I have my sterile gloves on, I can repalpate once it is dry and determine where that vein is at. Once I have determined where that vein is at and where I'm going to poke, I'm going to take my needle. So on this type of catheter, there is an initial flash indicator midway of the catheter itself. You can notice that is where the blood is going to show up first. You can also see when we talk about missed opportunities for catheters, it's when the nurse places it, gets that initial flash into the vein, but it's actually in between the different parts of the vein or the different layers. When you look at this catheter, you'll see that the actual cannula of the over the needle catheter is midway down of the bevel. To provide traction, you can do it in two methods. You can do the pull down method to provide traction and pin that vein, or you can create a C anywhere where you have cleaned to provide that traction. Once I have that traction on that vein and I know where I'm going to go and the vein is securely pinned, I'm going to go in at a 10 to 15 degree angle. Once we have the vein pinned, once again, you're going to come in at a 10 to 15 degree angle. You're going to notice that flash right away, and you'll start seeing in the flash chamber. You're going to advance a little bit further to get that cannula all the way into that vein. From here, you're going to thread that cannula by pushing off with your index finger and pull back until you hear the snap. From here, you're going to release your tourniquet. So after you advance the catheter, remove the guide needle and discard it in the sharps container. And apply your extension set. Now that we are ready, I'm going to get my blood return again. We have a great blood return, and we're going to flush that saline into that vein using the push-stop method. Once we know that that is flushed, we're going to remove our dressing. The way the dressing works is the notch should be in line with where the catheter and the extension meet. Gently apply pressure. The two pieces underneath, the slit in between goes underneath and crisscross. From here, you're going to remove the outer pieces of the dressing. The next piece that should go on is the overlay piece, and that just goes right where there is an opening. From here, I would gather my supplies, disconnect my syringe. We do have a name and date piece, but be careful when touching your pen and writing your initials and date before you place it on the patient. So I would just set this aside for right now, clean up my supplies, remove my gloves, wash my hands, initial and date, and apply that on the dressing. Now that I've placed my initial and date label, I'm going to wash my hands, remove my mask. Anytime you do direct patient contact and then you're going to be touching yourself, make sure that you wash your hands. I'm going to gather my supplies, discard them in the appropriate trash receptacle, and now I'm going to check back with my patient to ensure that everything is still okay and that she's not having any pain or complication with that PIV. So a couple of things that I would like to point out. If you ever have a patient who complains of sudden severe pain or numbness or sharp stabbing pain while placing a peripheral catheter, please remove it right away, as you may have hit a nerve. You want to make sure that your patient is well aware of how to flush and maintain that catheter. With our new policy, it states that we are able to leave a catheter in place as long as it is patent and free of complication. This means that our education is very important to our patients on what to report and when to report. If a patient has any signs or symptoms of infiltration, phlebitis, or infection, they need to let us know immediately. They should be assessing that site with medication administration and every 12 hours when they are flushing that catheter to keep it patent. If a patient calls and complains of any redness, swelling, warmth, that may indicate that the patient has phlebitis. This can occur up to 48 hours after the removal of a catheter, so it is also very important for your patient to know that. This concludes our peripheral video. If you have any questions or would like to consult a nurse, we do have 24-hour nursing available, along with policies located on our website. Thank you for watching.